Hi, everyone, and welcome to Research for Babies. Here, we translate our latest neonatal research into practical knowledge for healthcare professionals, researchers, and families around the world. Our mission is simple: advancing neonatal research, sharing knowledge, improving newborn lives. Let's explore today's study, our meta analysis of nasal interfaces versus face masks during respiratory support in less than 37 weeks gestation infants at birth. So, why does the interface matter? Well, the first breaths after birth are among the most important moments in a baby's life. And around 5 to 10% of newborns require respiratory support in the delivery room. And the interface we choose may influence how well ventilation is delivered. Traditionally, most babies receive positive pressure ventilation using a face mask. However, face masks can be associated with mask leak, airway obstruction, as well as the stimulation of the trigeminal cardiac reflex, which has been associated with apneas and bradycardia. Nasal interfaces may be an alternative. They may reduce airway obstruction, they may not trigger the trigeminal cardiac reflex, and allow clinicians to better observe the baby's mouth and facial movements during resuscitation. However, they might also be associated with more leak. But do these theoretical advantages actually translate into better clinical outcomes? That was the question we wanted to answer. To answer these questions, we performed an updated systematic review and meta analysis. We identified 7 randomized controlled trials, including 1,270 preterm infants across 9 countries. Across these studies, infants received respiratory support in the delivery room using either a nasal interface or a face mask. Although the individual studies differed in their protocol, they all asked the same important question: does the choice of interface influence important neonatal outcomes? By combining the available evidence, we were able to obtain a much clearer picture than any single study alone. So, what did we find? Our primary outcome was neonatal death before hospital discharge. Overall, there was no significant difference between infants supported with a nasal interface and those receiving ventilation with a face mask. However, one secondary outcome stood out. Infants managed with a nasal interface were 32% less likely to require delivery room intubation compared with those receiving ventilation with a face mask. This was an important finding because avoiding intubation may reduce exposure to invasive ventilation during the critical transition after birth or in the first days after NICU admission. For other important NICU outcomes, including bronchopulmonary dysplasia, air leaks, severe intraventricular hemorrhage, and intubation within the first 72 hours, there were no statistical significant difference between the two groups. Overall, nasal interfaces appear to reduce delivery room intubation without increasing adverse neonatal outcomes. Before changing clinical practice, it's important to understand one key limitation of these studies. The criteria used to decide when a baby should be intubated in the delivery room were not identical across the trials. Some studies allowed infants to remain in the delivery room longer before deciding whether intubation was necessary. Others transferred infants to the NICU much earlier. Similarly, thresholds for intubation, including oxygen requirements and clinical assessment, varied from one study to another. Despite these important differences, the reduction in delivery room intubation consistently favored the nasal interface across the available evidence. This suggests that finding is robust, but it also highlights the need for larger, well designed randomized trials using standardized delivery room management protocols. The current evidence suggests that using a nasal interface may reduce the need for intubation without increasing neonatal mortality or other important NICU outcomes. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with your colleagues. At Research for Babies, our mission is simple: advancing neonatal research, sharing knowledge, improving newborn lives. Together, we can give every baby the best possible start in life. Thanks for watching, and we will see you in the next video.